take you to Niger State, where the government says it is intensifying efforts to improve healthcare delivery by strengthening manpower and employing skilled health workers. Senior reporter Chinemi Bamai reports.
Niger State is recording steady progress in the transformation of its primary healthcare system under what the state describes as the New Niger Agenda, with a focus on expanding access to quality healthcare, especially in rural communities. As part of this drive, the state has commissioned 20 new Level 2 primary healthcare centers out of the planned 100 facilities, aimed at providing 24-hour healthcare services across communities. To sustain these gains, the Ministry of Health is holding strategic meetings with local government chairmen across the state's 25 local government areas to ensure alignment with the state government's healthcare agenda.
And we know that this engagement is both timely and strategic.
However, a major concern remains the shortage of health workers in public health facilities. Deputy Governor Yakubu Garba says that over 1,000 health workers are currently out of the system, a situation he says has affected service delivery at the grassroots. He assured that the state government is taking steps to recruit qualified health personnel to revitalize the healthcare system and improve patients' outcomes.
The need for manpower that will man this facility is very important. Without it, automatically it might come at us. So, but what we are saying, the local government should help the states, ministry and the primary care development agency with adequate data on the number of facilities, the staff that needs to man all these facilities for us to perform very well.
The Commissioner for Health, Murtala Bagana, emphasized the need for collaboration between state and local governments to strengthen primary healthcare delivery.
Is the issue of human resources. We cannot continue talking about the same story and approaching it the same way and expect a different result. So, as a ministry, we are coming up with a different mindset and strategy around how do we ensure from the local government we staff our primary health care center, we staff our secondary health facility, and we have the best of doctors, nurses, even at our tertiary level.
And it is even beyond the cliche, about not having enough staff. I think what we should also be looking at is the utilization of the current staffs that we have.
The state government says the combined investment in infrastructure and manpower is expected to significantly improve healthcare performance and ensure accessible, quality medical services for residents. Chinemi Bamai, TVC News, Mina.
Reporter Chinemi Bamai joins me now. Chinemi, it's nice to see you again. The state government has commissioned 20 Level 2 primary healthcare centers so far. How are these facilities expected to change access to 24-hour healthcare, particularly in rural communities?
Hello. The challenge of access to primary healthcare facilities has been a long-standing problem, not just in Niger State, but across different states in Nigeria, especially in rural areas. And ensuring that primary healthcare facilities are up to standard is a game changer for any government. And in Niger State, the government said they're not just revitalizing the primary healthcare centers, they're transforming them into what they describe as Level 2 healthcare centers that can provide beyond just basic health services to even helping deliveries, and even putting patients on admission until they recover. And the government has begun doing that by the plan of the government actually is to create 100 of these facilities, but they've begun by creating just 20, which they did last year. But right now, the conversation is, when will the others be done? This was done in 2025, but right now they're saying they need to do more, especially in collaboration with the local government authorities to ensure that adequate staffing is provided. You go to some of these hospitals, you have the facilities are there, but you don't have the right staff, especially in the hinterlands and the rural area, and a lot has contributed to that. Insecurity, access to roads, and access to other facilities, not just the healthcare facilities right now, has kept a lot of health workers away from those areas. So these are some of the things that the government is now entering into collaboration with the local government to see how they can solve that.
Thank you. Chinemi Bamai, thank you for your time and for joining us on News from the States. That's all the time we have.